Some people think fillers are unnatural because sometimes they do see people who are overdone. However, as long as you do everything in a natural way and in a more conservative way, it still looks quite natural and it brings more balance as well as more of a youthful, vibrant look to the face. Hi, I'm Dr. Peter Lee. I'm board certified plastic surgeon at Wave Plastic Surgery, a world's leading clinic. Today, we'll be discussing what dermal fillers are, what are we treating, and how long does it really last. So what are dermal fillers? Dermal fillers are products that we place underneath the skin. It can be at a more superficial level or a little deeper level, depending upon what we're really trying to accomplish. In the past, we used to think that dermal fillers are just volume replacement. That some people, as we get older, obviously, we do lose volume in our face. And it started off as a replacement for volume loss. However, now what we know is that it's not just about volume replacement. It is about using the products to actually lift tissues that actually sags as we get older. And also, we can enhance certain areas of the face to bring more definition and more youthful, vibrant looks. The dermal fillers that we're talking about, majority of them are hyaluronic acid fillers. Hyaluronic acid fillers are great because they are a natural substance that exists within your body, number one. The second thing is that it's completely reversible, meaning that for whatever reason, if you don't like the result, then we can certainly melt it completely. And a lot of the time, it depends upon the kind of area that we're placing the dermal fillers in, that it can last anywhere from 6 months to a year. The common places that we would inject these hyaluronic acid fillers are really kind of anywhere that patients really need. However, a common area for anti-aging purposes are the temple, the cheek, the submalar region, nasolabial fold, nasojugal groove, and as a replacement for what we call jawline definition, what we call pre-jowl sulcus. For more younger people that's looking for an enhancement of their features, a lot of times we are injecting into the lips, sometimes to the eyebrow, and sometimes we use it as what we call liquid rhinoplasty to enhance the nose, as well as chin definition as well. Although 80% of what we inject are hyaluronic acid fillers, for patients who require large surface area volumization, we tend to like now the L-polylactic acid fillers, such as Sculptra. And what these are these aren't products that actually causes volume replacement by the product itself, but it stimulates your own tissue to grow into those areas. So for large surface area like the cheek, submalar region, it stimulates your own tissue to grow in so that it's more natural and it's longer lasting, usually about 2 to 5 years. And because it kind of stimulates new collagen growth, it also gives an extra sort of lifting to the face as well. These days, there are so many different options, even among the hyaluronic acid fillers. And there are different brands and there are different terminologies that we use because they all have different properties. However, the easiest way to kind of really think about it, and the reason why we have so many options, is that for certain areas, certain fillers are more ideal than others. So the way to think about hyaluronic acid fillers is very smooth type of fillers, kind of like a little bit more firmer fillers, and something in between, like a medium consistency. And where we're placing these fillers really determine what we'll be using. For example, if we're using it in the lips, we want something very, very smooth and aqueous. If we're injecting it into what we call the tear trough, which is just underneath the lower eyelid, we also want something very smooth and aqueous. If we want more structure, for example, if we're injecting it into, let's say, the cheek area, that helps kind of lift everything up, then we do want something a little bit more firmer, and we're injecting these hyaluronic acid fillers in a more deeper space. If we are injecting it into certain areas for more structural purposes, like the nose and the chin definition, then we do want something a little bit more firm. And then for places like the smile line, we do want something that is more medium consistency, that's not too hard, and it's not too soft. How much filler do patients really need? And quite honestly, like everybody's so different. And it's not just how their state really is, like based upon physical exam, but it's also what the patient's really ready for. right? I mean, there are some patients who are brand new to the aesthetic space. So they're a little bit more conservative, and we as providers, we recognize that. So what we purposely do is that we take a more conservative approach. Then there are people who's used to doing fillers, and so they know exactly how much filler that they actually want. I think a lot of times our job really as a providers are really to kind of assess and really like talk with patients and really gauge what they're really ready for. If we're looking for a true 100% correction, then we are looking to be a little bit more aggressive. If we're looking to take a little bit more of smaller steps, then we are going to take a little bit more of a conservative approach. But in general, what we usually do is that for people who need cheek fillers, we're usually placing anywhere from like a half to 1 cc syringe on each side. If we're doing, let's say, a nasolabial fold, the smile line, then we're usually doing 1 cc on each side as well. And then for the lips, usually anywhere from 1 to 2 syringes. What you can expect from start to finish. After a full consultation and assessment and the plan, what we usually do is that we do place numbing cream on the areas that we'll be injecting for about 30 minutes. And then we do use a little bit of local anesthesia. So we do inject a little bit of local anesthesia to the area that we'll be placing the fillers. And then when we actually do inject the fillers, we don't use needles anymore. We use what we call a cannula, which is a blunt tip cannula, which actually causes less trauma, less pain, and less risk with these fillers. The injection of the filler themselves is quite quick, usually about 5 to 10 minutes. And then afterwards, there could be a little bit of swelling, not too much bruising. And in terms of recovery, there really isn't much of a recovery time. We don't really recommend icing after the procedure because we actually want good blood circulation to that area so that the product incorporates well to the tissue surrounding it. Filler procedure is quite common, and done right, it's very natural, and it really will enhance, especially in terms of anti-aging effect. To learn more, please visit worldsleadingclinics.com.